Now, there are many different types of dermal filler available. Hyaluronic acid is just the most commonly used one. So, for example, there is a dermal filler, one of the original ones actually, was made from bovine collagen, which is collagen that comes from a cow. Welcome to episode 7 of In Clinic. I'm your host, Dermal, registered pharmacist and lead practitioner at Clinic 1 Medical Aesthetics.
And I'm Alex, co-host and marketing specialist at Clinic 1.
Today's episode is all about dermal fillers. We're going to be talking about the different types and what they're made up from, and how we can use them in different treatments so that you can make an informed decision on whether dermal filler treatment is right for you.
So, why don't you start out by telling us what dermal fillers are actually made of?
So, dermal fillers in the common sense are made up from hyaluronic acid, which is this complex sugar molecule which has a gel-like substance in its injectable form. Now, there are many different types of dermal filler available. Hyaluronic acid is just the most commonly used one. So, for example, there is a dermal filler, one of the original ones actually, was made from bovine collagen, which is collagen that comes from a cow. So, this hyaluronic acid is chemically cross-linked during the manufacturing process, which makes it into this sort of malleable substance that's in a really stable form. Once we inject it, it kind of stays wherever we put it.
So, are all hyaluronic acid dermal fillers made equal? For example, are all the brands the same? Are they used to treat the same areas?
Well, not exactly. So, one of the key characteristics of hyaluronic acid is it's very hydrophilic, so it loves water. It can attract a substantial amount of it to the area that it's injected, and this is influenced by the way that it's manufactured. So, there are various different brands of dermal filler that might have multiple different products within their range that all act slightly differently. For example, we might have a certain brand of dermal filler that has two products within its range, and one of them might have been manufactured to be really viscoelastic, which means that when any shear force is applied to the filler, it manages to retain its shape and withstand this application of pressure. So it makes it really resilient to any force that's applied, and it manages to hold its shape really well. Whereas another product of the same brand might have been manufactured to be more fluid and free flowing, which means when any pressure is applied, it basically loses its shape. Now, this is useful for treating an area like the lips or something like that, where you want the filler to be a little bit softer.
What kinds of things can you do with dermal fillers then?
So, dermal fillers can be used to rehydrate, contour, and reshape. They can be used to add volume and reduce the appearance of fine lines, wrinkles, and folds. Essentially, they're a really versatile substance that can be used to restore balance and harmony to the face.
So, there are obviously the common areas that someone might get treated with dermal fillers, like the lips, the nose. What would you say is the most common in your clinic?
So I'd say the most common request that I get for dermal filler treatments outside of lips within my clinic is for treatment of the jawline, and more specifically jowl formation. So depending on the severity of the jowls, I can often use a thicker and more elastic filler to get a really good result and sort of seamlessly contour the jaw from the jowl towards the chin.
So, how long could a patient expect this treatment to last before they have to come back for more filler?
So with this type of treatment, you're looking at around 12 months, but obviously this varies from person to person. So depending on a person's habits, so things like smoking and drinking will cause the filler to metabolize a lot quicker. These are also things that age the skin quite severely as well. So obviously, if we're talking about the formation of gels, it tends to be in an older patient who probably doesn't have much support to the tissue, or they're kind of lacking support already. So these habits will cause the skin to age much quicker. So then there's things like excessive exposure to UV radiation, which is going to be damaging the skin and further reducing the amount of collagen and elastin in the skin. And then there's things like an individual's biological clock and their metabolism that also plays a role in how quickly the dermal filler becomes metabolized and how long the treatment will last. So there are various factors that play into it, but with a little bit of care, it can last up to around about 12 months before you need to start coming back for a retreatment.
And what about the risks of dermal filler treatment?
So, of course, with any treatment or procedure where you're penetrating the skin with a needle, whether that be an aesthetic treatment or having your blood taken at the doctor's, there's always going to be the risk of bruising. Now, this is one of the most common side effects of dermal filler treatment. There's also the risk of developing small bumps at the injection site. Now, these are little hardened lumps of filler, which tend to be quite benign. You can massage them out and they tend to just sort of dissipate over the course of a few days, but they can sometimes become inflammatory and what's known as an inflammatory nodule. Now, this is very rare, but that's essentially where the little ball of filler has become infected, which obviously is going to require stuff like antibiotic treatment and sometimes steroids. but again, that is very, very rare. There is then the risk of what we call a vascular occlusion. Now, this is the most serious side effect with dermal filler treatment, and it's where we get the inadvertent injection directly into a blood vessel or compression of a blood vessel. The good thing about vascular occlusions, although there's not many good things about them, but they can be reversed. So any practitioner you visit should have a thorough protocol for reversing the blockage of a blood vessel that's been caused by dermal filler injection. Now, this is done by means of injecting an enzyme called hyaluronidase, which basically breaks down the chemical cross-link bonding between each molecule of hyaluronic acid, allowing it to basically flow away or through the vessel with ease and restoring blood flow. So it's really important that any practitioner that you visit has this thorough protocol. And I feel like as long as a practitioner has these steps in place, as well as a few other little things that they can do to reduce the risk of these side effects, you're in pretty good hands.
Are there any other treatments that you might recommend to a patient to combine with dermal fillers to give a better result?
So dermal fillers can be used alongside various different other treatments depending on what your desired outcome is. One of the more popular ones that I see in my clinic is anti-wrinkle injection and dermal filler combinations. So what I always emphasize is that people book themselves in for a consultation because obviously everybody's needs and everybody's anatomy is so different that one treatment that I might recommend for one person might not be suitable for another. So it's always good to come and have a discussion with me to find out what treatments might work best for your areas of concern. If you'd like to put yourself in for a consultation or to find out more about the different treatments that we offer, click the link in our description, which will take you directly to our link tree where you can contact us via WhatsApp or download our treatment guide directly to your device.
Don't forget to like and subscribe if you enjoyed today's show. Hit the bell if you're watching on YouTube to get notified when our next episode is out. And leave a comment if you have anything interesting to say. Thank you for watching.